Good morning, good afternoon, good evening. I'd like to welcome you to this session. We're going to explore whether the recommendations that came from the WHO-UNICEF-Lancet Commission report that was launched in February 2020, so just before the pandemic started, whether those recommendations and findings are still relevant now that we are 1.5 years into the pandemic. And so I am Anshu Banerjee. I'm the Director for Maternal, Newborn, Child and Adolescent Health in WHO, and I'm the moderator for this session. I would like to hand over now to Helen Clark, who is the chair of the board of PMNCH, the Partnership for Maternal, Newborn, Child Health, as well as the former Prime Minister of New Zealand. And she is also the co-chair of this WHO-UNICEF-Lancet Commission. And I would like to ask her to reflect a little bit on, or summarize for us, what the main key recommendations were that came out of this report before we enter into the rest of the session. Helen, over to you.
Thank you, Anshu, and greetings, everyone. Well, it actually seems like generations ago that we were in Geneva in February, mid-February 2020, for the launch of A Future for the World's Children. It was sort of a feeling of like being before the flood at the time, because the public health emergency of international concern, re-COVID, had been issued, but the potential of COVID to assume truly pandemic proportions was just becoming clearer. And of course, writing our report, finalized well before then, we had no inkling of what was to come. And even at the time of the launch, we couldn't have anticipated the extent to which children's health and well-being would be so broadly, widely impacted. So now we're all, of course, hyper aware of how tough COVID has been on children and adolescents. But our report was based on the knowledge we had of the unprecedented threats at that time that children were facing to health and their futures, even before COVID. And we focused on three main issues. The first and foremost was the climate emergency. And now, as COP26 in Glasgow approaches, we're so aware that the world isn't on track to meet the targets set by the Paris Agreement. We're aware that this poses an existential threat to the health and future of children and is already damaging their health and well-being as the crisis worsens. Secondly, we identified how much children are threatened by harmful commercial marketing which is harvesting their data and targeting them with advertising for products which damage their physical and mental well-being, whether it be alcohol, tobacco, sugar-sweetened beverages, the ultra-processed foods, even gambling apps. There are businesses out there making a fortune selling children a lifetime of ill health. And that's before we even start on the aggressive marketing of breast milk substitutes aimed at their parents, which also has such a deleterious impact on children's health and prospects. Our third key message, we live in a world where children's needs, voices, and opinions just aren't taken into account adequately by so many policymakers. Children are paying a heavy price, perhaps the heaviest price, from failures to address the huge health issues caused by polluted air and water and the perpetuation of poverty, inadequate nutrition, poor housing. It is poor policy and regulation which allows the promotion of the unhealthy foods which fail to nourish children's growing bodies. Urban planning policies are creating dangerous conditions where children have no safe place to play. So our report says we need children to be at the forefront of consideration in all policies, so that their needs, their concerns, their views on the decisions that affect their lives can be taken fully into account. That is a central message of the report. We called too for a new global movement for children, and I urge everyone listening today to support the work being led by WHO and UNICEF, and also now by organisations like Children in All Policies 2030, which aim to implement the Commission's recommendations, working alongside everyone who cares passionately about children's health and their future. Thank you, Anshu.
Thank you very much, Helen, and for highlighting those 3 key recommendations around climate change, the commercial determinants of health, and also the health or children in all policies, the multisectorality around child health. And we hope that during this session, we can explore a little bit those 3 key recommendations. I would like to hand over to Almas Moudali. Almas is a young climate activist in South Africa, and you've just heard what Helen has highlighted as sort of the key areas coming out of the report. Could you reflect a little bit on your experience of the pandemic and also reflect a little bit on what this meant for other young people in South Africa?
Sure, thank you. Before the vaccine rollout began, children had to follow COVID regulations stringently to protect adults who are more at risk than themselves. But now that majority of the adult population is vaccinated, we aren't seeing the same responsibility among adults for children. This shows us blatantly how children are nowhere near the center of the COVID-19 response. In South Africa, the COVID-19 pandemic created a pandemic within a pandemic. Men lost their jobs during the lockdowns and resorted to alcohol abuse. They took their anger out on the most vulnerable in society, women and children. In a country where crime was already rife, cases of domestic violence skyrocketed because children were bound to their homes, sometimes with their attacker. President Cyril Ramaphosa took the decision to ban alcohol as part of other COVID restrictions to stop gender-based violence and consequently road accidents. It was extraordinary to see that after the alcohol ban, the emergency ward of Baragwanath Hospital, the largest hospital in Southern Africa, completely empty. This gave healthcare workers the opportunity to focus on COVID-19 patients. Many people in South Africa live in informal settlements, which do not have proper waste management, exacerbating disease and climate change. Children were affected the worst because when schools were closed, we were playing in these dumps. Living in a home that is not safe, productive, or sustainable is one of the largest threats to a child's well-being. However, COVID-19 hasn't caused any of these social and environmental issues. The pandemic only exposed these issues. The world was already walking a thin line, and COVID was the last weight on our shoulders to break it. I've learned many things from the COVID-19 pandemic, but one of the most interesting is how to mess with someone's mental health. Say you have a COVID-19 pandemic and a state of emergency is declared in your country. The government institutes a hard lockdown. Your parents lose their jobs in an already bad job market. All you have is virtual platforms to communicate with your friends and entertain yourselves. And then an unsustainable fossil fuel, carbon polluting energy provider starts rolling blackouts. At this point, all we can do is hope the water isn't cut because of a drought. Now that's a recipe to drive social unrest when vast majority of the population is living in shacks. This was the state of affairs in South Africa just a few months ago. So I hope we can learn from the pandemic and make our societies more resilient in the post-COVID world. Thank you.
Thank you, Almas. And you've highlighted a number of key issues such as closure of schools, mental health conditions for children, how that has increased, etc. Abubakar Campo, you are the Director of Health in UNICEF. And listening and reflecting on what Almas has just highlighted, you have come out with a report recently. Could you say a little bit how these issues play globally rather than just at a national level?
Thanks, Anshu. And I think Almas said it, but Almas said for South Africa was valid basically across the globe. I think in any types of crisis, whether it's the pandemic or whether it's security or whether it's climate, the first category of society would be affecting will be children's and will be women's. And it hasn't been different in this COVID-19 pandemic. When it comes to the health area, for example, COVID-19 doesn't affect as severely, children as adults, but the social consequences, of the responses to the pandemic has been quite damaging, even catastrophic for children. When we have lockdowns or when COVID-19 responses are basically hijacking all the health workers and resources, the first services which will be shut down are services which are directly put in place for women and children. And therefore, access to health services has been restricted even in this particular pandemic when we were trying to respond to the pandemic and getting it under control. Lockdowns, school closures. More than 168 million children have not yet been resumed schools. 168 million, that's a huge number. And for those who have been involved, in out-of-school children programs, they know how difficult it is to get children back to school, in particular when there's an age difference here and there. And it has been really damaging for children, but also for women, because when you close the schools, it means that many of the women had to abandon their jobs and stay at home to cut off for their children. So it goes beyond just the children. Mental health, I mean, Alma said it very eloquently. UNICEF launched on the 5th of October, the State of the World Children's, which for the first time, put mental, adolescent and child health as a priority on the agenda. And I think lockdowns, school closures have contributed, to mental instability, in particular for young children and adolescents. Violence against children has increased because they're staying longer at home. Exposure, as Helen has mentioned before, to not just advertisements, but also gaming, all those games, you keep your child, if you want to keep your child quiet, parents exposing them to gaming so that they can do other things, has not necessarily helped and contributed, to mental instability for adults and children. These are the factors, where we really could see how the pandemic has basically impacted children. And the last point which I would like to mention is that many families has been driven into poverty, and poverty is one of the things which leads people to inappropriate behaviors, behaviors which could be harmful for children in many, many ways, whether it's child labor, child exploitations, or just confinements, or inappropriate confinements of children. These are the kind of things that have been impacted, children's during this COVID-19 pandemic, and these phenomena we have been observing them globally, and that is also why we jointly, with all the other partners here on the ground, have been advocating for safe reopening of schools, really putting programs forward to address mental health, which hasn't been necessarily always that fruitful because addressing some of those issues needs a conducive environment, which the pandemic not necessarily have been always been provided.
Thank you, Abubakar. And the pandemic, as you already started highlighting, has exacerbated, of course, inequities. And so that has had a lot of consequences as well. It's really exacerbated those inequities and brought that also to the fore in our discussions. So Soumya Swaminathan, as the chief scientist of WHO, you have had to deal with these kind of issues around how to mitigate the inequities, etc. Could you say a little bit more about the inequities and how that has its impact on children?
Yes, thank you, Anshu. I think that's really been one of the devastating consequences of the pandemic. And as Abubakar just said, we had 140 more million children being pushed into poverty because many of the parents lost their livelihoods. And these were people who were already at the edge. They were already very vulnerable, just making ends meet. I mean, the status of food insecurity report that came out a few months ago clearly showed that in 2020, a third of the world's population did not have access to adequate food. And obviously it was an increase of 300 or so million people over the previous year. So we are actually reversing decades of progress in many of the SDG indicators, and we're really going to be struggling and lagging behind. So I think governments, this is the time for leaders and governments and agencies to really step up and put children, at the center of everything that they do for recovery, whether it's the green recovery and attention to climate, air pollution, for example, we know that that has a huge impact, not just on adults' lung and cardiovascular health, but on the brain growth of children who are exposed to air pollution. If their mothers, when they're pregnant, live in areas of high air pollution. So it's really investments in children is going to protect the next generation, is going to generate human capital. So for every country's economic progress, investing in children is the smartest thing to do, whether it's nutrition, it's education, or it's the other social determinants like housing and so on. I just want to link also to the digital connectivity issue, because, at the same conference, in fact, yesterday we had the launch of the Lancet Financial Times Commission on Governing Health Futures 2030. Again, this commission was set up just before the pandemic began, but its work was all done digitally. And it's really looking at what digital technologies are going to do for the health and reimagining universal health coverage in the digital era. So rather than saying digital technologies are going to solve all our problems, we say, what do we want to achieve in terms of health, in terms of education, and then how do we use the tools we have? And one of the unique parts of this commission was that there was a young people's commission, mini commission also set up to work alongside the commissioners. And there they had three major asks. One was that young people to be included in decision making. So I think governments, especially when they're thinking about the rules and regulations around data, technology, artificial intelligence, need to include young people because they are the ones who've grown up in this digital age. The second thing they asked for is that all young people have access. So digital connectivity as a fundamental human right. This commission is now asking, and I know that there's UNICEF and has the GIGA project with ITU, which is really looking at mapping connectivity across schools. And I think we need to do that same for health centers as well, because today without connectivity, you lose out on a lot. You're really going to be left behind. And then the third thing young people called for is global and national governance. So countries, so the WHO has taken the lead. We have a whole group that's looking at these emerging technologies and how to set up governance frameworks and regulatory frameworks, whether it's artificial intelligence or whether it's genome editing. But countries need to adopt also and develop these policies. And when they're developed, it has to be done in an inclusive way, taking all stakeholder voices into account. And children should play a major role in shaping some of these children and young people.
Thank you. Thanks very much, Soumya. And of course, we've seen that because of school closures, where possible, countries have moved to, let's say, digital or to, schooling through online classes, etc. And so I would like to bring in Margianta Suraman, who is the Executive Director of Emancipate Indonesia, which is an NGO working on modern slavery and particularly on young workers' rights. Gian is also a member of the Indonesia Youth Council for Tobacco Control. And as we look at this increased screen time, Gian, could you say something about your experience in Indonesia, what the impact has been of increased screen time?
Yes, thank you. So the effect of the pandemic has been very significant. A lot of young people who stayed indoors, adolescent and young people alike, we stay online most of the time because we want to connect with our friends. But then again, what happens is we still are facing some unwanted commercial harmful marketing, really predatory marketing, if you want to say, because they are really using the big data. They're targeting us in our social media. Even they provide free concerts from home and giveaways. I mean, these are the things that children and young people like. So these harmful industries, from alcohol, tobacco, and sugary products, they know what young people like, and they are, basically targeting children and young people when they are staying at home. And this is apparent, especially in my country, where the tobacco control regulations are not that strict yet, and we are working on it, believe us. And but sadly, of course, this commercial determinants on health cannot be neglected, especially after the pandemic. We just hope that governments will step up, because it is not enough to change the behavior of 1 or 2 people who are smoking, but it has to come from a structural change from policy level to actually help these corporations accountable and not put profit before people and planet and the well-being and health of its future generations, especially the children and young people. And especially young people, I think it's been mentioned, young workers struggle a lot in the pandemic. They have a lot of burnouts. And of course, a lot of them also resorted to smoking, alcohol, and other maladaptive practices. And this is also as a result of this commercial harmful marketings that are targeting this vulnerable young working class who maybe have a lack of access to mental health, facilities, or even inaccessible. Even though Indonesia has the biggest single-payer healthcare in the world, that we are proud of it, but then there just still a lot of work needs to be done, especially in terms of regulations and structural change. And I believe this is not only Indonesia's problem, but also all of our challenges, how to build back better after the pandemic, how to regulate better these marketings that are targeting children and young people, basically endangering their health and well-being.
Thank you, Gian. And you're just highlighting how relevant that recommendation from the Commission actually still is. Almas, would you like to reflect, was the experience on increased screen time in South Africa similar to what Gian just highlighted in Indonesia?
Yes, so I agree with what Gian has said about commercial marketing, but I would like to expand on his points. During the pandemic, youth were mobilized from all over South Africa to create South Africa's first ever Youth Climate Action Plan. The SA-YCAP, as we call it, contained policy recommendations for climate change and youth empowerment. The SA-YCAP is completed entirely online. I'm one of the high school liaisons for the SA-YCAP. I've seen many positives from a collaboration point of view when working on online platforms. Youth don't have civil liberties like adults. We need guardians to travel and hold meetings. In virtual spaces, we are able to collaborate freely and creatively without many obstacles we normally face. The SA-YCAP was a national process with a diverse range of climate change opinions from people all over South Africa. This would not have been possible without virtual platforms. Before COVID-19, we could only meet with youth in our own districts, but working online enabled the YCAP coordinating team to reach a broader audience from a geographic point of view. Social and digital media enabled the youth to come together and unite, even if we were not physically together. The virtual world has benefits and it's here to stay, but equally, as Ms. Sumaya said, if everyone cannot participate in the digital economy, there's an entire community that is left behind and silenced. There are small things that can be done immediately to combat the digital divide. We can consider digital grants. For example, the SA-YCAP gave children data grants to join our meetings online. So let's learn from the COVID-19 digital world and leave no child behind.
Thank you, Almas. And so we've heard now actually quite a lot about the way that the pandemic has affected children's lives in so many unexpected ways and also in devastating ways. But how do we move forward from here? And how do we begin to build a more sustainable world and societies for children? Naomi Lee, you are a senior executive editor at the Lancet, and yesterday you launched the Lancet and Financial Times Commission report on governing futures for the Governing Health Futures 2030 and growing up in a digital world. So following the comments from the previous speakers, what would be the next steps to build a more sustainable society for children from a digital perspective?
Thanks, Anshu. Thanks for the question. And yes, we launched the report yesterday. Following up from what Jan and Almas have already said, one of the key findings of the report really was when we began the report, we thought we were going to be talking about something that might happen in the future. But the reality is that digital transformations are already well underway. And the report highlighted that that is different for different people. So this is why they chose very carefully to use that term, digital transformations. And that's nowhere more kind of encapsulated than for children. So there was a survey done which was supported by the Red Cross, the Red Crescent and UNICEF, and that identified different profiles of digital childhood, from digital exclusion to being digitally consumed, so exposed to all of the kind of possibilities of the online world, but without protection, without the ability to protect oneself, and then being digitally immersed, so having all of the benefits that Alma's described, but being kind of enabled to take steps about their own security. So the Commission therefore positioned the transformation as a key determinant of health. And what the Commission said is that the current path of many of these digital transformations is largely extractive. So picking up on the points that Jeanne made about data mining, commercial exposure, marketing to children, if it's not extractive, it may be that it's heavily involved in the state and information is being gathered there about people in a kind of surveillance way. And the reason that the report focused particularly on children and young people is because they are the most exposed. So they're growing up in a world which is not the one that even I grew up in. And also that in many cases, they don't have the agency to protect themselves. They are being exploited in that way. What the report says is that digital transformations that are done without principles, the principles of human rights, will not deliver benefits of all. And the key points that were identified were co-creation. So this idea that young people must be, in whatever mechanism is possible, part of the decision making, and they require the skills, the tools, but also the position in order to be able to do that. As part of the young people call to action, they asked about trust. So they expect governments to protect them and to enable evaluation of tools or platforms or the security. This is their expectation of the people who are governing them. And then they also spoke about data solidarity. So the idea that we together as a community will share what we have in order to advance health. So you also asked me particularly about, you asked me for some positives, I think. And so one of the really interesting findings that came out of the Commission was from the U report. So this was supported by UNICEF. It was over 23,000 children, over 170 countries. 95% of the participants were in low and middle income countries, and they identified 3 things. So firstly, children and young people mostly use apps for fitness. They use digital platforms, so social media or online, to get health information, and they would rather get digital information or information from their friends than from a health practitioner face-to-face. So if you then think about what could digital do for health, then there are some interesting possibilities, particularly when we think about children and young people. So firstly, telehealth. So telehealth is one of the few digital examples that we saw scaled up during the pandemic and probably successfully. So we at the Lancet published some pieces about access to reproductive services, particularly abortion, removing the demand for face-to-face. And so those kind of changes do serve young people relatively well if we believe the results of the survey, which, it's a very big survey. So that's very positive. The second is around mental health. So we know that there's good evidence for many digital therapeutics for mental health. So interventions could be delivered at scale. But, as again, the Lancet Psychiatry touched upon in a recent editorial, the barriers are not really technical, although the focus is often technocratic. It's more on the kind of social and economic protections that we've highlighted. And then obviously, finally, just to say wellness, that many young people are not ill, but they are interested in using fitness apps, for example, to improve their well-being. But I'm going to kind of add a note of caution that all of those things could be possible, but we are not on track to deliver that at all. The prevailing message of the Commission is actually a wake-up call to say the digital transformations, especially when it comes to children and young people, have been extractive and not offering the potential that is there.
Thank you, Naomi. And of course, there's also still a digital divide, and not everyone has access to digital technology. And so at this point, I would like to bring back actually Helen Clark into the discussion. And Helen, would you like to highlight other areas that you think are key for us to focus on during the recovery, and what would potential solutions be?
Well, listening to all the very interesting contributions, what was in my mind was that rather than decision makers decide what it is that's best for children in the recovery, they need to be doing some consultations with their children of their countries, at all levels of government, actually, the local governments, cities, counties, through to national governments. Really create a space where children's ideas can be crowdsourced, where children have a platform to say, what is it that we need out of this recovery? Now, we know there's a lot of misschooling. That's distressing children in every country in the world. Particularly tragic, the 11 million girls whom UNESCO tells us will never get back to school as a result of the pandemic. So let young people say what it is that they need from policymakers to be able to recover. Also very interesting to listen to the conversation around the digital issues, because so much of our lives now are governed by whether we have access to connectivity, and there's huge equity issues here around the world, and those also need to be the subject of, I think, international solidarity, because shouldn't we have a right to connectivity, a right to information, a right to be able to connect in these ways? It will be the looming human right of this generation, I think. And I suppose my last point would be, yes, in health, there's been a lot of innovation with telehealth, but one does wonder, will one get to actually speak in person to a real health professional again? To what extent is there anomie, alienation from not being able to connect physically and directly with people who could be offering you services? How do children feel about that? Would they like to be talking in person, or is it a digital generation that is more used to doing things online as the norm? I think these are all very, very interesting questions.
Thank you, Helen. Maybe Abu Bakr, would you like to reflect a little bit on what Helen highlighted, and how do we bring in children into the discussion, and some reflections from your side?
Sure. I think it was said before, I think we need to make sure that children are part of the solutions and not throwing the solutions at children in that sense. In particular, when it comes to, adolescent, in particular, I think many of those programs, would have been probably a bigger receptivity if they were designed by the adolescents themselves, for themselves. Most of the information which children are getting, they're getting them from their peers. Even when we give them the right message at home or in the health facilities, they will go still and counter check, with their peers. Is this the right thing or not the right thing? So having better impact for adolescents would be working with those adolescents together, make them part of the solutions, and let them give their contributions for any of the issues which are basically affecting them. So I think this should be fundamental when we are designing policy. But I think it's not just about designing policies, it's also implementing them. So there needs to be an accountability framework where we can hold, decision makers accountable that they're actually doing what they are promising to do in favor of children themselves. I think there are many ways how we can improve. I would like to come back a little bit also on the digital solutions which we are promoting in a certain way. It is true, and it helps. I think Alma's just said it. I mean, it gave much more participations in a wider range for children. But let's not forget, many of those children do not have connectivity as well. Even before the pandemic actually struck, we have communities which are completely unserved about whether it's connectivity, whether it's any kind of basic social services. So I think we need to strike a middle ground, of going with digital solutions, but not forgetting that not everyone has access, in particular in low-income countries, where it has really basically created a huge divide between those who can access information through the EU report or through social medias, and those who live in a social media environment, but still can only hear about it and not basically participate in it.
Thank you. Thank you very much. So what will it take in terms of financial investments and government commitment to put the world back on track in view of, or in terms of children's health and well-being? Stefano Scarpetta, as the Director for Employment, Labor and Social Affairs at the OECD. What should countries be looking at to invest in?
Thank you, Ansho. Let me start by saying that it's really a great pleasure to participate in this session of the World Health Summit. I think the somewhat good news is that, as we know, many countries are investing unprecedented public resources into the recovery from the COVID-19 crisis. And I think, as we have heard from Ellen and from all the other speakers, it is essential, in my view, that adequate resources are also devoted to supporting children and youth, including their physical, but also their social emotional health. I think I don't have to repeat what Almaz, Jan, Abu Bakr have said about the dramatic impact of the COVID-19 crisis on children and young people. 1.5 billion students in 188 countries were locked out of their schools. A number of national studies that are emerging suggest that these already had a very significant impact on the learning, especially on the most disadvantaged young people. And I think it's going to be difficult to recover these losses in terms of learning. But also we know very well that the economic and social consequences of the COVID-19 have been hurting in particular the most disadvantaged children and young people. Across countries, of course, but also within countries. Unstable housing, food insecurity, social isolation, limited access to medical care create excessive and prolonged stress, and of course, particularly harmful for children and for their health and for their own development. When we look at young people as well, there have been disproportionate effect. They were the first to lose their job. It has been very difficult for them to find a new job. The youth unemployment increased twice as much as the adult unemployment, and hours worked declined by twice as much as for the adults. But I think what we have seen again from the emerging studies is that the COVID-19 crisis had a very disproportionate effect on young people, on their mental health, twice as much as what we have seen for adults. So I think the answer to these major challenges is really a holistic approach, investing on better outcomes, but also better opportunities for children and young people. This, in my view, is going to be key. They are our present, and of course, they are also our future. Tackling poverty and inequality, and of course, improving the health of children is essential. The physical health is a key determinant of the health status later in adult life. We know that very well. So investing on children's health is essential to actually give them a chance to have good health, but also, of course, to be able to fully participate in the economy. We know that very well. More than 100 million children worldwide are affected by obesity, and childhood obesity, of course, is strongly correlated with adult obesity. Protective factors for child health also include good neighborhood, environmental and housing quality, healthy nutrition and dietary intake, up to take vaccination, regular physical activity. I think previous speakers have highlighted this point. Conversely, high level of air pollution, unsafe outdoor equipment, housing quality, poor dietary intake, and so on and so forth have a detrimental impact on the health. So really, I think we need a holistic approach that cut across all the different areas. But let me say that I very much like a point that was made by Sunia, by Ellen, by Abu Bakr. We need actually to put children and young people at the center of the decision making. We don't have only to protect them, to help them, actually listen to them, because they have to be part of the decision making. They have to be heard, because we have heard from Almaz and by Jan, they have a lot of ideas which we have to factor in our basically policy making.
Thank you very much, Stefano. Rainer Ivanova, you are a young climate activist here in Germany. You have just heard Stefano talk about investing in clean air, air pollution having an impact on the health of and well-being of children and all people in general. This is your planet. You are going to be living on this planet for the next 70 to 80 years. What do you think needs to be done?
Yes, thank you. So let me start off by saying that according to the Federal Agency of the Environment, German emissions dropped by 9% last year as a consequence of the lockdown. And this was the only reason why we were able to achieve our 2020 climate targets. However, this was a short-term COVID consequence, and it came with major implications for the society and especially young people like me. In many ways, we saw that COVID worsened the situation of the most vulnerable, who often are also the ones at the front line of the climate crisis. And I, as a climate activist, and also when talking to many of my other friends who are climate activists, I noticed that all of us shared this big struggle that we felt extremely left alone during the pandemic, because we were so overwhelmed, because we felt like we had to balance two global crises while also trying to adjust to the new online school format and all of the other mental implications that came out as a consequence of the pandemic. We noticed that even though we put in just as many hours of work and just as many extensive projects, our outreach, because of the new online format, was significantly lower, which was very frustrating to see. But nevertheless, there is one central thing that we learned from the pandemic, and it is that change is possible when leadership is taken responsibly. During the lockdown, we all, or at least I, saw how big our impact on the environment is in my own city and also globally. And while humanity can be the most destructive force on the planet driving us into this climate catastrophe, it can also be the most constructive force for positive change. So, like in the climate crisis, in the pandemic, children were the most affected. And while our voices were overheard at big conferences, we still kept fighting for a seat at the table. And for a short time, we saw that COVID had a positive effect on the environment. But since last year, we've again seen a drastic increase in global emissions, which is not in line with Germany's national climate targets or with international climate targets like the one of the Paris Climate Agreement. So we cannot lay back on the emissions that we saved last year, but instead we need a deep-reaching structural change that takes into account social justice and global equity in order to keep global warming below 1.5 degrees Celsius. And I particularly demand empathetic leadership from our world leaders that takes into account the most vulnerable and the smallest people, and which actively advocates for a socially just and environmentally friendly society.
Thank you. Thank you very much, Raina. And I'd like to bring in Sunita Narayan now, because Sunita, you as the Director General for the Center for Science and Environment in New Delhi, you have been working on these issues for a long time. And we know that less than 1/5 of the current recovery packages are actually targeting green investments. So having listened to what Raina just highlighted, we needed a pandemic in order to be able to achieve our 2020 emission targets. But knowing that we're going back to normal, let's say, we're starting to travel again, etc. What is the need? What is the change that we actually need in order to be able to achieve the goals? And you're on mute, Sunita.
Sorry. Thank you, Anshu, and thank you, everyone. I mean, I think every speaker has so clearly enunciated what needs to be done. For me, you know, as Raina said, my city of Delhi, I live in Delhi. Delhi saw blue skies during COVID-19 because there was a complete lockdown. I mean, we could smell clean air, we could hear the birds, the song of the birds, and we had clear lungs. I mean, it was magical almost. And but the problem was that it took a complete shutdown, a lockdown, to bring us those benefits. And it is very clear that's unsustainable, because also, as many of the speakers before me have said, that COVID has put a disproportionately high a disadvantage for the poorest in the world. It's had a disproportionate impact. And if you look at the loss of livelihoods because of COVID-19, it has hit the poorest the most. And then within the poor, it has hit poor children the most. Also so well said that whether it was the loss in India because of schooling and, you know, all the digital, I love the word digital, the digital future, but it's also very clear that it's not an equitable future. And so it's important for us to recognize that divide, which is even more stark today than yesterday. So I think given all that, Anshu, and given the fact that we've understood first time in the world, I think the benefit of COVID has been we've understood interdependence. We've understood the fact that nobody is safe till all are safe. We've understood the fight between the variant, the vaccine, and the virus, and the need to vaccinate all at affordable rates, the need for public health care for everybody. It's the same thing with climate change. We know today that unless we talk about climate justice, unless we talk about the energy needs of the poorest in the world, we will never be able to combat climate change. So it's important for us to see this as the way ahead. And that's really where I see the framing for the future has to be very correctly, as said, children at the center of future policy, but also to think about the multiple crises and the interrelationship between the multiple crises and how they're impacting children. COVID and its impact on children, climate change and its impact on children, poverty and its impact on children, lack of clean water as a preventive, health as a major determinant of good health. And look at that in terms of how do we move ahead. And that's where the Building Back Greener movement has to situate itself. It has to put a human face on it. We are too lost in targets and SDGs and numbers and abstract notions. I think it's time for policy to really put the face of the child on how we move ahead. And that to me will determine how policy is empathetic and equitable. And that would perhaps provide us some space of how we move ahead. Thank you.
Thank you, Sunita. I'd like to open up the floor for the panel members actually to come back into the discussion and the conversation and to comment maybe on each other's reflections. And maybe, is there anyone here on the podium who would like to reflect, particularly on what Sunita just highlighted? Soumya.
Yes, I just wanted to comment to Sunita's point on putting children's first. I mean, we saw during the pandemic that most countries shut schools down at the beginning when they went into full lockdown. But then a number of countries actually prioritized the opening of schools over other activities. And I think these were particularly the high and upper middle income countries, but then a few examples, in the low middle income countries as well. But even till today, there are a large number of countries, several dozen countries where schools have not reopened. So you can imagine the fate of these children who've been out of school now for almost 2 years, not only, missing out on education, but on nutrition, on social support, on escaping domestic environments, which often lead to violence and so on. So this is an example of prioritizing children's well-being, where governments really, before opening up restaurants and movie theaters, should have, and even today should prioritize the safe opening of schools. And we know that it can be done. And the other point is the vaccine inequity that we're seeing today in the world is going to continue to widen these disparities, because till communities have vaccinated their adults, they're very scared to open up, schools, because we know that the infection can transmit between children and then get into adults as well. So while I think these are under-recognized, the side impacts, negative impacts of vaccine inequity, which is going to have for the next generation.
Abu Bakr?
Yeah, I was trying to make exactly the same point, but I think it's a little bit sad that it's a pandemic who needs to remind us how important climate change is. It is even sadder that it's children who need to tell us how important climate change is. These things are not really, they are really interlinked. I mean, the pandemic, new viruses, climate change, environment, they are interlinked, they're not disconnected. And I think, we ought to bring to ourselves, that, investments in greener solutions, investment in healthcare, investment in education, these are cornerstones which everybody should be pushing forward. And if decision makers are unable to do so, then it means that, we should not be called parents, because at the end of the day, the obligation of a parent to their child is to create a better future for them. And I think we have been failing. If this needs to be reminded to us by a pandemic, or if this needs to be reminded to us by our own children to moving forward. Schools, and I think this was probably the best example that we have seen during the pandemic. These were political decisions to close schools, to give the impression that we are doing something against the pandemic. And the reason why I'm saying it that these were political decisions is because during the pandemics, when you have uproar among populations, we close the schools, but we open political rallies or we open restaurants, contradictory decisions, which do not make any public health sense, but which we're taking to give the impressions to some people that something has been done, but we're taking decisions against children, because these decisions which were made were mainly affecting children and not the adult population. I think we need to reverse this trend and really looking very seriously in towards ourselves and say, okay, at what point, what crisis needs to be happening so that we're realizing, the way we are going right now, we are off track of delivering for children.
Thank you. Naomi, you would like to come in as well, I see.
Yeah, I mean, 100% agree with what Abubakar said, but I just wonder, look, what if we flip this round in our minds and say, it's not that we need children to remind us about the climate crisis. The problem is we have the climate crisis because we don't have children as fully autonomous individuals in our mind of governing our countries, our communities, our world. And so when we remove them as stakeholders, as decision makers, and we imagine them, they don't reach something that requires to be counted, or it doesn't have economic value, or they're not voters until they're 16, 17, 18, then we will constantly repeating this cycle of short-term policies without any long-term plans about climate. It's not that they have to tell us, it's just that it's an imbalance of power, really.
Raina?
Yes, just elaborating on your point, because I think it's very interesting. I mean, as a child myself, I often feel like I'm regarded as half a human and not a whole human. And I actually think that this whole discussion needs to change in a direction where it's not the children telling the adults what to do, but the children working along the adults, because you cannot talk about the climate crisis or children's health without regarding the perspective of children themselves. And even when looking at conferences like this one, I mean, we are talking about children's health today, and there's like 70% adults in the conference room. And so I think more meaningful youth participation is a very essential part of that, because if youth are not included and informed about the issues that impact them, they cannot make their voices heard.
Thank you, Raina. Let me go to the panel members online, and maybe first start with Gian.
Yes, thank you. I'm just weighing on what Raina just said. I mean, it's important for us to have meaningful youth participation in order to improve health and well-being for children and young people. But also, I would like to remind us which children and which young people are we talking about? Because sometimes we think like they are some uniform group of populations in the paper. But then when we see the disparity between the global north and global south countries, whereas as in my country, global south countries like Indonesia, basically access to healthcare, it's also very heavily affected by how their parents get their rights as workers in their workplace, especially for young working mothers, for example. You don't have childcare if you cannot afford healthcare, if you have a gender pay gap, etc., and you cannot afford for your children to have a better health and well-being. So basically, sometimes I think my point is we need more than health webinars like this, because we often have this kind of like, we would like to children and young people to count their carbon footprint and do beach cleanups rather than speaking up against the fossil fuel industries who have been, basically creating these air pollutions that is affecting their health in the very first place. Or maybe we would like to also just rather ask children and young people to stop smoking and do healthy lifestyle, but then also rather than regulating the harmful commercial marketing, or even, basically how they target children and young people to be continuously addicted to their dangerous products for the sake of their profit. So basically, this is very clear. And I think I really like what Naomi mentioned. It's not us basically like putting children and young people as the face of the movement. It's not that. It's about when we put them in the table, what are we going to facilitate with them? Are we going to really listen to them? Are we going to maybe like support them to generate evidence from their own communities, to experiment, to innovate, not only technological, apolitical, technocratic innovations, but also social innovations, community-led solutions? I think we need to embrace the complexities in engaging meaningful youth participation and children, because it's much more complex than that. And not all children and young people have basic needs. And it's really affected by how the young working class, who many of them also have children, so young people with children in the working class who've been, basically many of them are being disunionized, not being given their rights during COVID, being let go. Basically we need to see this aspect as well, the social determinants in health and commercial determinants in health, and speaking more about accountability of the government also and corporations against civilians and young people and children in the communities. So basically that, I think we need to address that imbalance power relations, and we need to work it out in solidarity, and in a German word, zusammen, together.
Thank you very much. And Stefano, before you come in with your comment, there's a question that we have from Yuriko. We have often talked about the principle of inclusivity at every level, but we need practical examples on how to include targeted groups, in this case children, to the policy level or as part of the policy advocacy, apart from just seeing them as a population in a scientific study. And I know that when you looked at your work, you have included voices of young people as well. So maybe during your reflection, you could also just reflect on this question.
Thank you, Ashur. Let me go back to one observation Abubakar was making. It's indeed, I think, sad that we're talking about the green transition. We had to wait the devastating COVID-19 crisis to really try to get our action, to try to make progress on climate change. But be as it is, now there are very significant resources that many countries are put into the green transition. Of course, the children and young people is the generation of living today that has most at stake on when actually how we are going to make this green transition, right? If we make it wrong, they will face the consequence of climate change. If we make it wrong, they will also face significant public debt that has to be dealt with, right? So I think listening to them, involving them in an active way, in my view, is essential. But I think to some extent, we have to make the green transition right also because we know that the risk of poverty for children and for young people is associated also with the household in which they live. We know very well that the green transition can generate millions of jobs. I mean, we have estimated that 2.5 million jobs only in the OECD country can be generated in renewable energy. But also we know that some brown jobs might disappear. And therefore, we have to really take care of how we manage this transition to make sure this will not create new pockets of poverty or household without a job, because this again might affect the already disadvantaged children and young people. So I think managing the transition really with a life cycle approach, but taking into account also the risk for the children, for the young people themselves, but also for the household, for the parents with whom, of course, they are living. Let me go back to the comment that was made by the participants about how to engage with young people. We're actually developing for the OECD countries what we call the youth recommendation. So really a commitment by all member countries of the OECD on how to do better for young people. And in that process, we actually have involved the young people themselves. We have shared with them the draft of our recommendation, the draft of the policy principles. And what we heard over and over from them is that, yes, they provide a lot of comments. They certainly need more support all along from, early childhood education and care all the way through when they transit from education into the labor market. But I think over and over what they said, we want to be part of these designing and actual implementation of policies. We know what we need, and we need to be brought in, not just in terms of providing support to us, but actually giving us the opportunity to decide about our future. That's, I think, the approach we have to do. Of course, it's easy to say, but let me tell you, in this consultation process, this will go all the way through to the adoption of this recommendation of the OECD. And actually, young people have been asked to be part of monitoring the implementation of the recommendation itself. That's a novelty for the OECD, but I think a very welcome new thing, because that's exactly how to do it.
Thank you, Stefano. And before I go to Almas, Helen, and Sunita for additional comments, I'd like to welcome Professor Awa Kolsek. Professor Awa Kolsek is the Minister of State to the President of Senegal, and she is, together with Helen Clark, the other co-chair of the WHO-UNICEF-Lancet Commission. And Awa, welcome to the session. And would you like to reflect on your experience in Senegal, but maybe also beyond Senegal, on the impact of the COVID pandemic on health and well-being of children and young people?
Thank you. I would like, first of all, to really congratulate my co-chair. And it is important to have two chairs because of this situation. And what she has said on our report, which is somewhere a report everybody needs to have today to be able to act and to act now. What we have said is that all the analysis, everything has been said. Now we need to do something. And more we are waiting, more difficult the situation will be. I would like to just also say that what I have heard is something I like a lot. And I would like to particularly refer to the issue of having the young people in the driving seat, young people completely integrated from the beginning to the end where we will take decision, and also when we will go in the field to do the job. It is important also for young children, young people to know that the old have been young at the moment. And we are not completely out of the loop because, and we have grandchildren, we have children, we are following this. And it is why we want you to be at the center, because it's your place. And I have heard things I like a lot, and I think that we will continue to support you, and you will be, in fact, what you have to be at the middle. In Senegal, the 3 points has been very key. COVID-19, we have not been really starved. We were there also. And it has been very difficult because of the health system, which is very poor in almost all the African countries. But also it has been, we have a very strong impact on the health system, but also a socio-economic impact. It is why we have done some calculation in Senegal to know what is the impact. And what we have seen is that almost 300,000 children will not have access to antibiotics for pneumonia, for example. But also more, 550,000 will not have access to some immunization with diphtheria, tetanus, but also polio. Now, it's just to say that the COVID-19 has impacted on all the indicators we have for children. We don't have time to go on to all of them, but just these are examples from Senegal. When I look at the climate change, you have discussed it already, but in my position, I would like also to do a sort of advocacy, because 86% of the pollution is coming from the north. But the impact in the south is bigger because of the condition we are living. It's sure if we have inundation, floods in the north, people quickly, and we are looking at it always on TV, or quickly are reacting. They have a lot of means to be able to help their population. And if you are in Africa, I take the case of Mozambique, where they had a lot of floods, and everybody knows that it is because of climate change. At the end of the day, they were struggling for a long time, and this has been impacting the agriculture and all the problem of nutrition now in this country, and this exists everywhere. It is why we need really to be able also to stand up and say, we cannot be the one where you will have a lot of impact and we are just doing maybe 14% of the pollution. So this is something we need to understand. The marketing of commercial marketing, I would like to just give an example of link with COVID, for example, or floods. A child with not at school because of COVID, at home with a mother who is just lose her job and have a lot of things to do in the house. When they have a TV, they are happy to put this child in front of the TV because it gives time to do other things. But what is happening there? You will see a lot of commercial marketing. And it is not only sugar, drink, this is important, all alcohol, because alcohol also between two soccer, you have the beer and this is the children who are there. But also when you look at all these games, for those who have the possibility, without any restriction, I know that this is also a problem. This is a case, but it can be multiplied. This is what I wanted really to add. I can say a lot, but I know that a lot has been said already. And I would like people to read to the report and have a look at it and maybe see a lot of things has been said, and we need only to now implement them and act. And this is also an issue of solidarity. This world is a global village. What happened here can have an impact there, etc. And it is important that people know that we are all together. If people are vaccinated in the north and they are not vaccinated in the south, COVID-19 will stay here. If the climate also, people are not taking all together decision, you will see the impact will be in these countries, but also in others. So it is a global village, and we need to go together and put as a sort of line, solidarity and equity. Thank you.
Thank you very much, Awa. And also, we have done a lot of global monitoring, but global modeling. But you have highlighted how important it is to do that also at country level, to really understand what the problems are at country level and how to adjust policy to react to that. So let me go back to the other panel members and maybe some quick reflections from Almas and then Helen and Sunita before we go to the last round of questions. Almas, over to you.
Thank you. Just reflecting on these discussions, I think COVID has shown us that whilst tackling issues like climate change and COVID-19, we had to consider other social issues in society. As Reina and Ms. Sunita said, at the beginning of the pandemic, there was a brief drop in CO2 emissions. It showed us that we can solve climate change, but in order to sustain these gains, we must consider the intersectionality of environmental sustainability with social, health, and economic issues. A green transition that benefits all people is the only transition that will solve climate change and truly put child health where it should be, society's top priority. After all, you don't want a sick human race to inherit a sick planet. And I would also like to bring in the South African Youth Climate Action Plan. Our first pillar acknowledges the intersectionality of climate change. It demonstrated the non-neutrality of climate change and how different socioeconomic factors such as race, gender, income, and age compound how climate change affects us. By highlighting these systemic issues such as gender-based violence and climate action, it ensures that no one is left behind and that the most vulnerable in our communities don't become shock absorbers for climate change. I think the YCAP is a great example of how youth are participating and criticizing constructively. We just want to be included. On the question posed, I think a great example is including people's stories and lived experience in policy. The YCAP did that. Every pillar has a corresponding story from an activist. I think stories are so important because, for example, when I interact with my fellow youth activists in South Africa, the more privileged children want to have no plastics campaigns, but the more underprivileged equally don't want to pollute the environment, but they use these plastic bags as school bags. And if we don't listen to people's stories, we will never know of those people using plastics for good. And including stories and lived experiences in policy also allows people to contribute if they can't contribute in the traditional academic form. Thank you.
Thank you, Almas. And you just highlighted, I think, also the point that Sunita had made about, it shouldn't be the most left behind, the most vulnerable who pay for the climate change actions, let's say. Helen, I saw you nodding a lot when Sunita was talking earlier, so I'd like to come back to you for some reflections.
Yes, I wanted to pick up on what Awa Marie Cole-Sek, my co-chair on the Commission, said about the inequitable impact of these huge crises that we're living through, both the pandemic and COVID. And Awa set up very sobering figures about the lack of access to basic immunizations in her country, and so on. So, there is an intersectionality here. Everyone's impacted, but some have been impacted so much more seriously than others. And the inequity of the vaccine rollout between high-income and low-income countries is just so stark. Then also the point Awa made about the climate crisis. We know that Africa has contributed the least to the crisis emerging, but the impacts are very, very hard felt, not least in the Sahelian countries, of which Senegal is one. I've been to Senegal, coming from a country where it rains a lot, to go to a drylands country in the Sahel and see what a struggle it is to get the water, to have the arable land, to produce the nutritious food. And children are just so terribly impacted by this. So let's, when we discuss these issues, have this sort of burning sense that there are equity challenges here that we have to get on top of, and the world's poorest children are the children most impacted.
Thank you. And Sunita, over to you.
So, I think I'd just like to add two things, Anshu, to a very, very rich panel discussion and debate that we've had. One, I think your big question, and I think the question that everybody has said is that, okay, we want children at the center of decision-making. How does it happen? And I have a slightly different take on this, Anshu, and forgive me, panelists. I feel that we can talk all we want, but children will all, it's difficult for policy to call upon children with the diversity that we will need to be able to define the policies for the future. I mean, in my country, we have rich children, we have poor children, we have advantaged children, which have one set of problems, disadvantaged children, which have another set of problems. And so I think there are two tools that we should really be exploiting and working on for the future. One, I think, is data and information. You know, I work on air pollution in Delhi, and we have been pushing very aggressively to get policies so that we can actually clean up the air of Delhi. And we have been successful. And the real trigger for this and the change came when we were able to link the health of children and people to deteriorating health, to deteriorating quality of air. And I think there is a much more, we need to understand and make the links much more robust in terms of the impact on children. And as Soumya so, poignantly and rightly said, that it's about the generation that is going to take over our countries. It is the generation that is going to have to run the world. And if they are going to have impact on their health, on their mental health, on their ability to socialize, on their education system, on the midday meal that we have. In my country, we are seeing the double impacts, the double whammies because of climate change on already poor communities, huge impacts because of people losing their ability to survive. I think we need to put, as I said earlier, the human face, and that's the children's face, on every policy document so that we understand the impacts. And that combined with the second reality of the world, which is the realization of interdependence, the realization that it's not just the rich that will lead the world, but we have to take the poor along with us. I'll give you another example from my own world of air pollution. I mean, we can do everything we want to clean up Delhi's air, but we will never succeed unless we can have the right to clean energy in the homes of very poor women. And the impact on children because of cooking on dirty fuel, we know is very bad. But it's also very bad because the air shed is one. So the rich may use air purifiers and believe they're safe, but they have to breathe the air. And I think that interconnectedness of society today is something that we know today more and more because of climate change. We know more and more because of COVID. So we may have been able to marginalize the voice of the poor in the past and really not think about it. And that's why inequity has grown in the world. But I think today the need for survival means that we have to work together. And I think if we can work on those two principles to move ahead, to me, we get much more humane and children-centric policies in the way ahead. And lastly, I just want to emphasize the point about the commercial determinants to health. It was mentioned earlier, and I just want to flag that's something that we need to talk about because that is coming from industry and it's impacting the health of children today and tomorrow. And we do not get enough action on it because the industry is too powerful. It's the tobacco industry of yesterday, is the food industry of today.
Thank you, Sunita. And in fact, that was actually going to be my final question for all panel members. The main recommendation coming out of the WHO-UNICEF-Lancet Commission was actually that we should put children at the center of all policies. And I wanted just to go around and ask everyone maybe to reflect on that for 30 seconds, whether you feel that this has happened, and if not, how do we actually achieve that? How do we bring that change? I think many people have already highlighted that this is something we need to focus on, but what is it concretely that we need to do? 30 seconds for everyone, and Gian, you first.
Yeah, so basically, I think in the end of the day, we just have to not only listen to young people, but engage them meaningfully and to take into account basically the complexities of the needs of children and young people and their various conditions in the world. So in short, I think decent work for the young working class who are struggling, inclusive social protection, including access to healthcare, and commercial marketing regulations, commercial determinants in health being regulated, not deregulated, are the best buys policies for adolescent and young workers' well-being.
Thank you. Helen.
One of the recommendations of the Commission was to explore the feasibility of an additional protocol to the Convention on the Rights of the Child, which would address commercial determinants and the rights of children to grow up without being exposed to these pressures. So I know, Anshu, that you and others have been carrying on a conversation with the Human Rights Commission of the UN, and I really hope that this can lead somewhere with a government standing up and saying, yes, we'll champion this.
Thank you. Stefano?
Thank you, Anshu. I think we are still collecting the evidence, but the diagnosis is very clear. So COVID-19 has a disproportionate dramatic effect on children and young people. And I think in particular to the most disadvantaged of them within countries and certainly across countries. There is a clear risk of a significant long-lasting scarring effect on children and young people. So I think moving from talk into action, we really need to take the opportunity of the recovery that many countries are investing on with a holistic life course approach. Realize that investing in children and young people is the best investment, even only from an economic point of view, let alone from a social point of view. I think we need three areas: the health of children, addressing the risk of poverty, which has shifted even in the OECD countries from the elderly to young people and to children, and actually address inequalities. I think really we have to move from talking into action, and we need to look into how each and every policy has a focus, has a positive impact on children and young people.
Thank you. Almas, 30 seconds, because we have 5 minutes left for the whole session.
It's very simple for me. The whole voting system is fraught with inequality. The history of voting has been racist with the exclusion of people of color. It's been gender biased with the exclusion of women. And now the voting system discriminates against the youth. The same reasons used to exclude people of color and women are being used against the youth, that we don't have the intellectual capability to make our own decisions. Like the voting system was changed to include people of color and women, the same principles should be applied to allow youth to vote. Education should not be an excuse. If we need to change the education system, so be it. When the youth are equal citizens, real change will be ushered in, as we will vote with our feet.
Thank you, Almas. I'll have to go to the next participant. And is there anyone here on the podium who would like to add any thoughts to what has already been said?
Can I just say that I just want to highlight that data is very important. Monitoring indicators and accountability from all sides, whether it's governments, whether it's the multilateral development banks, they are the ones who are going to invest a lot in the recovery now. And so we need to see where that funding is going and ensure that the principles are followed. I know the Commission came up with an index, and we need to track that to see how countries are doing.
Very short, Abu Bakr.
Yeah, I think I would be having it on three aspects, which is one, there needs to be heavy investment in health so that we get to universal health coverage, heavy investment in education, and heavy investment in climate change transformation. And this needs to be monitored. I say we need to work with the young people. And I would actually even propose that young people should be monitoring us. They should be coming up with a monitoring framework and every year presenting it to the United Nations General Assembly, and we should be taking it seriously. If that's happening and decisions will be changing, then we can say that young people are actually part of the whole process and we are taking their recommendations seriously.
Thank you. Naomi?
I'll pick up on what Almas said, which is there are ways to engage youth and to consider them as whole people. But I think when we look at what's happening outside of this panel, when we look at the UK cabinet during the pandemic, there was one woman. And then we wonder why we have policies where women are working and the schools are closed and the men are writing their papers in Nature. This is baked into the power structure that we have. And unless we challenge this, we're not going to be able to include children at the center of every policy.
Rainer, any?
Yes, so I just have a very simple, short key message, and it is that It has to start with education. Children need to be educated on the issues that impact them, and then they need to be given a platform at, for example, conferences like this, and also when big scale frameworks are discussed in order for them to bring in their perspective and decide how they want their future to look.
Thank you. So by this then, maybe I can come back to you for some closing remarks and final reflections for this session. Thank you.
Thank you, Anshu. I would like to really highlight key things, and it will be 5, because I think that all the discussion we had went around the need to improve planning by focusing on equity in our investment, in our policies, in everything we will be doing. We need to do that for COVID, but we need to do that for climate change and for also marketing, commercial marketing. And we need to do that now. We must also listen to children and young people's voice. And what has been said today is very clear. We need to engage them, and I see that a lot of initiatives are going on, but also to be able to ensure that we are speaking to those who need to speak, because sometimes you will go around and take some people who are not representing anybody or are more vocal but not in the field to do things. So it is important also to put them at the center of the policy. And also we have heard them. They are so good. I think that we need to be convinced. Another thing is really to look at commercial marketing. We have for too long looked at advertisement and all these things without having concrete actions. And we need to know that they are very harmful for children, for young people. And I have not said, and maybe it's important to put it clear in our report, we have been very clear on tobacco, for example. We need also to work together, because having a lot of initiative is okay, but coordinated and working together with all the competencies, all the ideas, this will give us more results. The last point for me on this panel is to give opportunity and better place children and young people at the center of the recovery we would like to see from COVID, for climate change, for this social marketing, commercial marketing. We would like the children, the young people to have a future. And if we apply everything we have said today together and now, we will see change. Thank you.
Thank you very much, Awa. And so that brings us to the end of this session. I'd like to thank all panel members for joining us for a very engaging discussion, I thought, and all participants for being here. Thank you very much.